Good afternoon, runners, and welcome to our coaches chats. And we have our partners at HNS join us today. We're going to talk about your back pain, what causes it, how it can affect your running. We're also going to be talking about the ins and outs of just general runners injuries, and of course, a whole lot more. So definitely stay tuned. And as always, put your questions in the chat because we want to talk to you guys about what's going on in your running day. So whether that's your training questions, your race day questions, your injury questions, please put those in the chats. But also, I want to know where you're watching from. A lot of people, as you've come on the show a lot, we get viewers from all over the country, sometimes all over the world. So put those in the chats. A virtual high five to whoever is the farthest away from me right now in New Jersey. So I do want to welcome our special guest from Hospital for Special Surgery, physical therapist, Anil. Thank you so much for joining us.
Thank you for having me. Excited to be back.
Yeah, man, it's always a pleasure to have you on the show. I know our viewers know you. You give some of the best advice to runners out there. So thank you very much. I want to jump right into it, guys. As I said, put those questions in the chat. So Anil, a lot of runners, they come to us as coaches, unfortunately, instead of you guys. They have a lot of injuries. And we talked about the whole body spectrum being everything's connected to itself. And with running, we think of the lower legs as being a primary example of what runners should be using, but there's obviously more involved with runners than just their feet, their legs, their hips. There's also that upper body and the back I want to specifically spend time on because it's important to runners having that strong back. So how does your back play into a runner's daily workout? Maybe it could be.
Yeah, so I mean, if I think about it, right, the back is really the key to everything in your body, right? It's sandwiched between everything, and so and that is really what it does in every task that we do. It's the stability factor. Now, a lot of people think about when they associate the back, they associate the abdominals and all of your core musculature, right? And the core musculature is really there to create stability, inherent stability in your body so you can do whatever task that you want to do. So for instance, a lot of times, like, when you're not, having that stable core as you're, reaching mile 18 or so, those legs are really starting to feel tired. And so is those abdominal muscles, right? That's when people start to have that back pain, when they start to have some kind of hitch in their pattern where they have some kind of stability issue in their abdominals and in their low back. So really, whenever I have any athlete, but really any patient that I have, we do a lot of lower back stability based exercises, because whatever you need to do, whether that is run a marathon or walk down the street, you need to have good stability in that low back.
That's awesome. It's very important for sure. So a lot of runners, they might say from time to time their back might hurt from running. What causes that? Is it weak? Something in the body is weak, and so you strengthen that? What could be the cause of maybe a hurt back while running?
First and foremost, I would go right into the form. There could be something in their form that could be leading to extra strain in the back, likely some overarching in the back. A lot of times when people have a long stride, for instance, they really start to arch that low back and really kind of magnifies the forces that happen there. So I would always go with form first, especially if you're an avid runner. If you're an avid runner and you've had extensive experience with different types of conditions, there could be a hitch in that form. But a lot of times it has to do with core weakness and also hip weakness too. Everybody knows, especially if you tune into a lot of the segments that I do, a lot of those monster walks and clamshells, I always recommend, just because they really get the hip and core nice and strong. So a lot of times, it has to do with your core musculature as well as your hip and glute musculature.
You touched on two of them, clamshells and monster walks. Anything else we could do at home maybe to strengthen those back? Because actually someone did say in the chat a second ago, where is it? Kathy says back hurts during long runs. So kind of a question, but also a comment. Is there things that people can do at home that they can work strengthening the back area or avoid back pains?
Absolutely. And so, and excuse me, I should have also mentioned, flexibility concerns as well too. So, for instance, the two muscles in particular that really have a strong relationship on the hip, pelvis, as well as the low back, will always be those hip flexors and those hamstrings, right? So, for instance, the hamstrings, just to kind of give a perspective, because everyone kind of thinks, oh, it's in my hip or whatever, but really the hip flexors attach up into that low back, into the spine itself, and it runs down your leg. So if you think about it, if those hip flexors are tight and not mobilized, or not properly strengthened even, that can really give some weird pulls onto the spine that are causing pain. So I would say addressing flexibility and mobility first in hip flexors and hamstrings. But again, yeah, we're thinking about a lot of stability-based movements within the core and glutes. So, we can plank for days. That's great. But if you're not adding some kind of rotational component, or different types of movement with your core, then you're not really practicing it for that long run, right? So I would suggest things like pale off presses, which are pretty common out there, which is simply like having you're kind of holding a resistance, while the resistance out to the side of you, so you're kind of working against that rotation of whatever resistance that you're doing. I love doing a lot of like carrying. So for instance, farmers carries, which is holding two things in your hands as you're walking, and focusing on good posture. Same thing with suitcase carries, which is just pretty much just holding something heavy in one hand, where you have to fight the stability on the other side. So I mean, you're gonna hear this a bunch of different times. What can I do? What can I do? Honestly, and every patient that comes to me goes, I really want to get my abs back. I really want some core exercises. And I tell every patient, and I really, really believe this, every exercise can be your core exercise if you really think about it. Because as soon as you start to think about stability in those abdominals and the low back, your core will turn on, and it'll kind of, again, magnify your performance.
You also mentioned in an earlier response about the form is very important to avoiding any back issues. HSS does gait analysis and form correction, correct? Can you kind of talk about that a little bit?
Yeah, I mean, we have different tools here. We have a whole running program, geared towards our athletes. As far as like return to run, as well as just simply you feel fine, but maybe you want to check out that performance. So we have a whole running analysis here that we do, which kind of covers both from a perspective of a physical therapist, as well as our exercise physiologist as well. So the two kind of entities kind of come together to really focus on that, the patient client, and improve their running performance. So what that means is you come in, and we kind of assess your running form. From there, we also go through an exam too, before and after, to see how you walk in the door, how you kind of normally are, and what the effects of running has on you. So we'll kind of repeat that assessment. Then we try to find the best types of exercises, or different types of education, in order to kind of fix those things, so you become the best runner that you can.
Love that. Such good information. Guys, if you have questions, please put them in the chat. I want to go with some great shout outs from you guys all over. We have Jassy says hi from Club Rise to Run. We have Marcella saying from Florida, Belisa from Brooklyn. We have Margaret from California, Redondo Beach. As of right now, the farthest one. We have Alberta from Brooklyn. Kathy saying, Kathy was our comment earlier about her back hurts during a long run. So hopefully, Kathy, some of that information did help you. If you have a specific question, Kathy, please put that in the chat. We could answer those. We have Denise from Bergen County, New Jersey, which is about 5 minutes from me. And then Scott, all the way from the UK. Scott, your virtual high five, says right now being our farthest viewer. Scott, thank you, and everyone for watching today. We have a question actually from Jassy. This is more for you, Neil. She says, I have been to 5 chiropractors, 0 benefits. I have lower back pain. How can I go to HSS? Costs kind of where should she go? Where should she go now?
Yeah, so I think I think starting with a sports medicine based physician could be best for you. Here we have, two types of entities, like a sports medicine physician who specialize in like non-operative treatment, and then we also have physiatrists who, again, do the same thing, but really kind of a little more specialized in back. So I would say either one of those two would be totally fine for you to get a really good in-depth look. Right away, everyone wants to kind of jump to our surgeons, but 9 times out of 10, there's no pathology that warrants that. So I think you can definitely kind of find benefit through there. From there, there are many different options as to what they might look at for you, but really we kind of look at the whole picture here. So I would say that if you've been to chiropractors, for an extensive period of time and they're not working there, perchance you just need a different perspective. So I would start there. So a sports medicine physician who specializes in non-operative treatment, as well as a physiatrist. So we have those on staff here. And then of course you come down to CSA, will most likely refer you right to us, to physical therapy. And again, we kind of look at the whole picture to kind of get you better.
Awesome. Jesse, great question. We have Tiffany asking a question, kind of what I was talking to you earlier about your gait analysis at HSS. Looks like she was interested in that. So he says, where can I find more information on the analysis? I'm assuming the gait analysis. Does insurance cover this? If not, what does it cost for a session of that? Maybe dive deep into that.
Gotcha. The logistics stuff for that, unfortunately, I do not know that offhand, but you can, go on our website, hss.edu, and follow the links towards sports medicine. You can even type in HSS sports rehab and performance, and that should take you right to our services. And from there, you can definitely inquire. The reason is because, for the most part, we've always had this this service, but we've kind of revamped it to make it even better and make it more streamlined for the consumer, and also make it a lot more scientific and evidence-based. So therefore, with all the logistics, things may have changed. So therefore, definitely go on those things that I just said, and they'll definitely be able to steer you into the best realm. I know right off the top of my head that we are definitely doing them at our Sports East Side location, which is located like right by the main hospital, which is about 70th or 71st in New York. So you can definitely call over there.
I love that. The gait analysis is important, like for all runners, healthy or not. It's a great thing to do. So definitely check in on that, Tiffany. Teresa has a question. How does taping help injuries?
Yeah, so taping is like, just like we were talking about before with the core and the low back. Taping is a form of stability, but external stability on a particular joint or even a particular muscle, for instance. So you're gaining external factors in order to stabilize whatever needs to be stabilized. So I mean, everybody knows about ankle taping, for instance. Pretty much every basketball player will get their ankles taped before a game, and one is to create stability, and two is just because they've been doing it forever. So it's like almost like a ritual type of thing. But that also lends the question of, do you need taping for your body? Because a lot of times, especially a lot of taping methods for runners can easily be fixed, or I shouldn't say easily, more simply be fixed with good skilled exercise, for that joint, for that muscle, whatever the case may be. And then you have other kind of taping methods out there that are really for pain, really, such as like kinesio taping, for instance, has shown to have some good anti-inflammatory properties, as well as sensory kind of properties, where it kind of blocks those pain receptors. So they're for many different reasons, depending on what you need.
see a lot of taping questions, and you see it more, I think, during Olympic season, Olympic weeks, which is now, but it's winter, so you don't see it as much because people are covered up. But you see it volleyball players with the shoulder taped up, or, you know, a lot of different outdoor sports, or runners even. You see, you know, some of the professional athletes with the tape out there. So it's a really good question. Again, I love those questions. Our last question for now, and then I'll jump in the next segment. We have Marie, she's from Maine, and she says, what do you suggest for dealing with piriformis strain?
So that's a tough one because you know, I'd like to generalize and say that most people have felt this kind of pain, especially if you're an avid runner, or honestly if you just work at a desk job, because you know that piriformis is really where you sit, and sometimes that pain can kind of shoot down the leg. Now, a lot of times the piriformis itself can just be kind of inflamed and kind of pinching on that nerve. And sometimes you can have a strain where you have a little bit of a tear in the muscle causing you pain too. I think it's important to differentiate as to what you have, and that's where a good evaluation from either a physical therapist or you know, a sports med doc to really find that out. But I will say, you know, when we're talking about, you know, a piriformis strain, meaning some kind of tear in that piriformis, the first thing is, you know, it could be a little bit of a mind blow here, but you don't want to stretch it. Okay, you don't want to stretch something that's already torn because it'll tear even more, right? So what I would suggest is, again, good solid exercise, or potentially just mobilization. So just working through the ranges of motion that you have within that piriformis. Now, if we're talking just purely like, oh, my piriformis is just very mad because I sit on it all day because we're in a pandemic, or I'm running and, you know, just have that type of pain, then again, I would suggest good solid mobilization exercise. But that's when you can really dig into a little bit with a lacrosse ball, or even focusing on those piriformis stretching, like the specific ones in particular.
I love that. Guys, like I said, put any questions you have in the chat. There's some amazing questions. I want to dive into those. And also, as always, let us know where you're watching from. Right now, Scott from the UK is our farthest virtual high five winner. So let us know where you're watching from, and we're going to jump back into those in a little bit. But Anil, we have not just back, but general ins and outs of injuries, and you're the person to talk to. So as a coach, a lot of runners tell us that they have sores or discomforts. They're at like a group training program, and I have my Achilles is sore. Now, a lot of these, as I find, they start off as just that soreness, but then they become worse. So how do we distinguish, especially new runners, from maybe being tired to a soreness or discomfort, and what should they be looking for in their body, especially from a new runner standpoint, to not extend it to something more?
Sure. I think you know, we've all had that experience where you have a great workout or a tough run or whatever, and then the next day or the 2 days later, you can't walk, you can't do anything. You know, you can't go up and down stairs. To me, that is a very appropriate response to good solid exercise, a good solid load on those muscles and joints, especially if you you know, really took yourself outside of your comfort zone. I'll give you a very brief story. I took my first ever group exercise class a couple of years ago. It was myself, my best friend, and we're in a class with literally everyone. Definitely was a mom in there, and they kicked our butts. We could barely do anything, and of course we came in there pretty cocky and stuff like that. For 2-3 days, both of us couldn't walk, and it wasn't because, you know, let's just say we're not strong or agile or whatever. It's because, like, truly those exercises that in that group fitness class, just we couldn't handle that load. Our muscles weren't trained the same way. So to me, that's a very appropriate exercise response to something that you haven't done. And I think we've all experienced that. But when it becomes more sinister is when those things start to linger and really linger for a while. You know, you can't do normal tasks. Even something simple as just like, you know, stepping off of a curb, and all of a sudden it's just this intense type of pain. You know, for instance, if it keeps you up at night, that's the number one reason to really seek help there. And then, you know, really, if it is that sharp stabbing pain that happens, you know, that really disrupts your daily routine. If it's something dull that kind of lingers, but, you know, you're still able to do X, Y, and Z, that's a little different on the grayer side of things. But I think understanding what we train for, and understanding if that is an appropriate response is how we really catch injuries early.
That's really good advice. So a lot of times also, we say when you're injured, you ice it. You put ice on it for 15 minutes. That seems to be what we just technically, I was brought up, just put ice on it. Is that true for most of these runner injuries? Should we, 15 minutes? Is it heat? How do we just, without going into maybe a physical therapist, doctor, how do we decide what to do with our discomforts, our sorenesses,
I think if the textbook will say if it's an acute injury, you want to ice it because you want to calm down inflammation, dull the pain, and things like that. Maybe decrease swelling with ice. And if it's a chronic injury, for the most point, you can heat it or ice it, whatever you want. I will just say that for many years of practice and being around so many different people, clinician, athletes, patients, whatever you want to call it. Truly, it really is dependent on the person itself. And I will make the generalization and say that honestly, movement is usually best for everything. Now, of course, there is definitely a time and place to ice, to heat, but really movement is the best thing. Now, if we're talking about I get this sharp stabbing pain every time I move, again, that's a little bit more something different. That's where you really want to calm it down, ice it, things like that. But if it's just that, dull pain, soreness, things like that, yeah, movement is definitely the key. So that's why, having a good solid cool down routine, and everybody knows who watches me know that I say have a cool down routine, because that really is the first step in your recovery, and where you don't even have to heat or ice.
Talk about that cool down routine. What is it? Is it just walking maybe 10 minutes after your run, and then maybe like some simple stretches that we all do? What is a cool down routine for most maybe people have done before?
True. Honestly, if one of my patients or athletes say that, for my cool down, I just walked a mile, I would take that, because usually no one wants to do it. But truly, a good solid cool down routine would be, we'll take running for example. You just finish your run, you can decrease that run to a gradual walk. Okay. Again, you don't want to just stop abruptly, because that's when a lot of injuries happen. So just kind of gradually moving into a walk. In that walk itself, you can start doing some simple stretches. People kind of neglect the arms, but you really can really throw that arm up there, stretch out those triceps, stretch out the pecs as you're winding down, even doing arm circles, things like that. As you're walking, you can get up into a quad stretch and continuing to walk. Um, but after you have an adequate cool down where that heart rate really drops to close to resting, that's when maybe you want to get on the floor, maybe do some foam rolling, or maybe do some, static stretching, being that, the classic of, with the strap, kind of pulling up that hamstring, things like that. But again, it's all about that heart rate, all about those muscles gradually cooling it down, and then you take it to something more strategic like foam rolling or static stretching.
I love that. I love a good cool down. So also let's talk about rehabbing injuries. A lot of runners, I think shin splints is something that a lot of runners, unfortunately, just happens. I think everyone at some point in their running career gets shin splints, unfortunately. Something like that specifically. What is the best way to rehab and get back faster? Are there things you do to say, okay, shin splints, do X, Y, Z, or is it determined on the severity of shin splints and maybe where they are exactly?
Definitely, it's determined on the severity of it, because there are some cases where shin splints, as soon as you touch it, people have a reaction. People have a pretty visceral reaction to it. So I think it is dependent. But truly, in layman's terms, a lot of it has to do with, again, form in running too, not accepting the load properly, especially when you're striking, and then going off of that, some inadequacy in your chain and in your kinetic chain of your body that has, leading to more force towards that area. And then, as you speak on it, the general rehab for shin splints is number one is going to be rest. Okay, that muscle, which is called your tibialis anterior, is really inflamed, really pulling on that tibia, your big bone there in your leg, and so therefore you also don't want to continue to work it out and not rest it, because again, a stress fracture could develop with that too. So really, rest is number one. Adequate stretching is going to be a big factor there. Stretching your calves, stretching that muscle in the front of your shin there, and then I would say gentle massage to kind of push any fluid or swelling out of there, and then very simple exercises to retrain the muscles of your foot to start accepting load again.
It's really good advice. I like that. And then my last question for you, and then we also, like I said, tons of questions from runners. If you have not submitted a question, please put that in the chat. We're going to take that after these. A lot of runners here might be training for the United Airlines NYC half coming up in just under a month. Are there any injury prevention routines they could do right now to maybe get themselves to the start line healthy and ready to go?
I think a solid, if you haven't been checked out by a professional yet, and like, hey, you have this deficit for this reason, I think you should work this out, and again follow their plan there. I think a solid full body routine is going to be important. We often train for our sport by doing our sport, but really you want to train for your sport by doing your sport and other things. So cross training for sure, as well as strength training, huge, for example. And then if people always want like a routine, I would say pick a body part and do 2 exercises per body part, and that way you kind of cover all your bases. But just like I said, and maybe we have to turn this into a trademark quote, but every exercise is a core exercise if you think about it. All right, so definitely really find your core, think about your core through every exercise that you do, so that way you're better trained for any element that you have when you're running.
I love that. Every exercise is a core workout. I like that. Let's jump into the questions. We've got some really good ones, a lot of them. So we're going to go through these. We have Klaas from earlier. I'm sorry if I pronounce your name incorrectly, I apologize. Klaas. Any advice for overseas travelers? I will arrive on the 18th for the race on United Airlines NYC half on the 20th from Amsterdam. Thank you for joining us coming from out of country. You might be the farthest now watching it, a little farther than the UK. Yeah, I think for me, I'll give my take. There's 2 ways I always see runners do it. I've never gone out of country for a race, just different time zones in the United States. Either start getting on East Coast, New York timeline gradually. So maybe from the 16th, 15th, you start gradually adjusting your sleep patterns, your wake up time. So then when you get to the United States or get to the East Coast, you are more on the time pattern, the sleep pattern. It won't be a biggest change. The other way is it's tricky, but you also just don't adjust at all. You just kind of stay in your own pattern on the morning of. You might be it might be messed up a little bit because you're losing time, so that you might be a little bit tired the morning of, but maybe a nap the night before might help. So I either find that you either get on it earlier as soon as possible, or you just kind of stay in your normal time. You might take a nap the day before, and you don't normally nap, which is fine. I like getting on time zone as soon as possible, so get my body acclimated to the new time zone that I'm in. It works whenever I travel, which helps me. And then once again, I don't know how long you're staying for, but sleep on that plane ride, heading home. Anil, do you have any advice for maybe coming from out of country and how that body reacts to that?
Well, I'll tell you right now that I just came back from Copenhagen, Denmark yesterday, and I am struggling. So let me tell you, definitely have a routine, a planned routine. But again, just like anything else, like you train for it, right? So know what works best for you. Jet lag is a real thing, and it can really affect your body. So I would say just being as organized as possible with travel. Oh, and of course, when you're on the plane, do some exercises. All right, you can definitely do some stuff. But really stretch out, keep the legs loose, and just make sure that you're hydrating, especially on that plane.
That was going to be my question on the airplane. What can they do to recover a little bit better? Because I'll probably be leaving that day or the next day and sitting for many hours. Our next question comes from Maricel. Any suggestions on patella pain in front of the knee?
Yeah, with that, it's a very umbrella diagnosis, as I like to say, just because it could be a bunch of different things, because a lot of things send pain to that area. But likely enough, like for instance, some kind of muscle imbalance where that patella maybe not be tracking properly on the knee, meaning it's just not moving in the groove that it should, and therefore you can have that pain that arises in the front of the knee there. A lot of times that has to do with flexibility in potentially your quads, your IT band, or just simply strength. Strength in the quads, strength in the glutes, the hamstrings, things like that. Now, that's kind of a global type of way to look at it, but truly, it could also be, something in your stride while you're running that causes more pain or more force that goes right through that knee. Both overstriding and understriding can do that. So, it really is a way to find a way to see what can potentially cause that. If you haven't gotten that checked out and it only happens while running, then I would suggest definitely getting your gait analyzed.
So another question from Jassy, Jassy Burke. She says, as I have pain always, but before long runs or marathons, I take painkillers the night before. Is that okay to take painkillers before marathons?
I don't think legally I will not say yes or no to that. But what I will say is that a marathon is something that people dream about and really strive for, and it's a very hard thing to complete and to train for. And so a lot of times, if you have to get to the finish line, you have to get to the finish line. But you did not hear me say anything definitive here. But I will say that just the accomplishment of getting to the start line is important to understand. So, however you need to prepare to get there and to do your race, you know your body the best.
All right, I'm going to jump in. Jesse
I think
actually
I
had
handled
another
that pretty
question.
well. What do you think, Steve?
Yeah, I loved it. I loved it so much. Jassy actually asked another question, so I want to jump ahead here. Sorry on the back end, Craig. She had another question. After long runs, do we need a few days very easy or continue hard exercise workouts?
Oh yeah, recovery is going to be important. I would not exercise vigorously, whatever that means to you. If you, I think you have to recover somehow, whether that mean doing a set of rehab based exercises to help you kind of recover a little bit quicker, or maybe even doing some cross training by biking or swimming or something like that. But no, I would not suggest rigorous exercise.
Jassy, what we always tell runners for coaching is, no hard days back to back. So if that long run is considered a hard day, it's hard on your body, and long is whatever it is for you. So it could be 5 miles, it could be 20 miles, and that the day after that is what Anil said. Same with the speed workout. If you're doing a tempo run or an interval workout, track workout, that's a hard workout. So a rest day after that, and a rest could be cross training, an easy run, a walk, a rest full on. So no hard runs back to back. We have a next question. Denise asks, what are the benefits of different types of runs? Example, speed, fartlek, recovery. I'm having trouble running at different paces. Yeah, Denise, this is a thing that a lot of new runners kind of experience is you have one pace and that's it. And the negative about that is you have one pace. You need to learn different paces to get, if your goal is to get faster or more anaerobic, grow longer. Because if you have one pace, you're not going to really get better at it. You're always going to be that 9 minute per mile, and you're probably going to max out probably the same distance because you're not slower. You can run farther. So if you're running like a 10 minute per mile, you could probably take that, that 10 miles and run a little bit farther. And then if you want your time to go faster, once again, you're going to do those speed workouts as fartleks, is where you're going to get that time down and a little bit stronger as well. So you're working different muscles as well to those different types of speed workouts. Let's see, we did Jassy. We have a question from Teresa. Does tapering really work? I've done it before, but always wondered how helpful it is. So from a coach, I'll start from a coach's standpoint, and then I want Anil to definitely talk about it. So tapering, for those unsure of, basically when you have like the half marathon coming up, you're training for about, I don't know, about 8 weeks. And then the last 2 weeks, you're kind of what's called tapering, and you're bringing your volume and intensity down. So you're going from your last key long run, which for a lot of maybe new runners, about 10 to 11 miles, that last long run. And then your next week's runs, you're running the same amount. So you're still running 3 days a week or 4 days a week, but your mileage is getting lower. Your intensity is also getting lower. Your body's recovering. So you need to recover for that big race you're doing. And a lot of times I tell runners, you're either getting healthy for that last 2 weeks of race. So if you have a small discomfort or you're extra tired, you're recovering for that time, or you're staying healthy. Nothing you do in those 2 weeks is really going to benefit also your goal race. So the United Airlines NYC half, the last 2 weeks, March 14th, for instance, nothing you can really do during that time is going to help your time or your pace come March 20th on the New York City half. So you're just trying to maintain over the following, the 2 weeks of that taper period. Anil, anything you want to add about the tapering for runners?
I think that was perfect, and I think maybe an analogy, if you follow other sports, it's like that marathon or that race that you're training for, that's the playoffs, right? You're not going to and you fight with the regular season as you're training, right? But at the end of the regular season, there's always a couple games where you're just like, okay, I'm good. Let me start to decrease my energy output, or let me sit a couple games or something like that, so I preserve my energy. It's the same thing with running too. It's a real factor of energy storage. You can deplete all of that, prior to that big race day, because your body still needs to recover always. So that's why a good tapering method is beneficial.
Yeah, I also just find it from a confidence standpoint. So you're going to, those 2 weeks sometimes are hard for runners, or 3 weeks for a marathon. It's hard for runners because they're used to running 10 miles or 20 miles, whatever your goal distance is there. I like for runners to get to that start line like a rat in a cage. They want to be ready to go. They're confident. They've been resting. They're just like, I've been sitting at my house, doing nothing, still a few miles here and there, but you're ready to go. And that's a big confidence booster instead of coming to the line and you're tired and you're worn out. So we want you at the start line feeling very healthy, 100% healthy. Goal for every runner is to get to that start line healthy. And those last tapering weeks are key to getting you healthy. Let's see. We have a question we talked about this earlier, so it looks like a follow-up, maybe more information. Pavilion for shin splints. Other than resting, anything else to help quickly recover?
Great question, because this is all very subjective, right? And we talked about being very dependent on by the patient itself. So I would say that truly there is nothing that I can tell you that is definitive, because this is an overuse injury. This is an inflammatory based injury, and so you need the time in order to really recover, and that might be different from person to person itself. But what I would say is that, again, movement is definitely important. So let's say if you had the means of using a pool, for instance, you can jump in that water there and, practice walking, practice different types of exercises in an unweighted environment. So not only are you helping the rest of your body recover and gain strength and mobility and things like that, you're also loading that area appropriately, but in an environment that allows you to do so without pain, and you can really work through full ranges of motion within that. So I would say that would probably be my other form of advice. Another thing too is something, another passive tool such as electrical stimulation, or gentle massage, or even compression stockings, but of course closely monitoring, because we don't want too much pressure to build up throughout there. So it really is dependent on your symptoms and the severity of things.
Great answer. I love it. Hopefully that helps. Last question from Cheng. What time is wave 5 at the start line? So all start lines, waves, what corral you're in, what wave you're in, will be announced on our website late this month, early next month. So hang tight. We will present that information to you guys way ahead of time. And so keep an eye out for those emails, and also always keep an eye on our NYRR.org site for all of the changes to whatever race you have coming up. And then I want to give a final shout out. We had come through here. We had Sunflower and Lilies from Long Island, New York, saying hi. Thank you for watching. And then we have Indu from Hillsburg, New Jersey. Thank you so much for joining. And thank you to all the runners who joined our chat today. Anil, thank you so much for sharing your wisdom again to all the runners out there. Yeah, and runners, we'll see you next time. But good luck in any upcoming race you have. And thanks again. We'll see you next time.